While this is loading, it's great to be here, and it's also great to be able to build off the two presentations already, because a lot of the stuff I thought I would have to cover actually has been done in a very nice job ahead of me. So yeah, I'm glad to be here to present some of the work I've done here with Barb, and also Chris McLeod, who's standing up with his mobile phone there, and Lil Tamburik back in BC. Yeah, I think it was back in 2018 when I ran into Barb at a work and health conference in Toronto, and from there we kind of sparked this common interest in looking at work disability among mobile workers. And just a little bit about who we are. That's Chris and I and Lil. We are at the Partnership for Work Health and Safety. So we're a research unit at the School of Population and Public Health over in Vancouver in British Columbia. We work closely with researchers. We work closely with stakeholders, various different types of stakeholders, to address current and emerging issues in work and health. And I'd just like to acknowledge that we're very fortunate to work on the traditional, unceded, and ancestral territories of the Musqueam people. So Barb's already done a very nice job of explaining this. But basically, yeah, why do mobile workers matter? I think we all have a good idea of that now, but certainly up until the pandemic anyway, there's more complexity in the mobility of our work. There's upward trends in some measures of mobility as well. If you think of people from Atlantic Canada traveling up to the oil sands, they have an important role to play, whether it's bringing money back to the regions where they're from, where there might be higher rates of unemployment, so supporting their family, supporting their community, but also filling, labor shortages in certain resource industries. But we know from the kind of limited but growing research on these types of workers, they tend to work in very high-risk industries. They tend to also, they have poor return to work outcomes and unique challenges because of that. And from a research perspective, these are also very challenging workers to capture. I'm seeing it from a more quantitative researcher perspective, but I was having discussions with people doing work like Sarah's work with the fly in, fly out. If you want to speak to these people or interview them, that's really challenging as well. So this is just another graphical way of displaying what Barb showed on our table, but it's about 14% of the Canadian employed workforce in 2021 engaged in various forms of extended or complex mobility. Focusing on the kind of work which has been done within the kind of lens of a workers' compensation system, using workers' compensation claims data and surveys and things like that. A lot of the work has actually come out from Alberta. The work Sarah's doing, the work that Nicola Cherry's done, and a lot of it tends to focus on these oil sands workers from Atlantic Canada. But myself and my colleagues, we've been able to do some similar work using data from BC, using data from multiple provinces. But generally what we find in terms of work-related injury and compensation claim rates is that for mobile workers, in the sense of out-of-province workers relative to within-province workers, is that they tend to have less claims showing up in the data. And then from the survey work that has been done in Alberta, it seems like only about a third of those with injuries actually bothered to file a claim with the Workers' Compensation Board. And that's due to a whole range of factors which have already been discussed, but it could be due to like the hassle factor of having to deal with the extra paperwork, or the fear of losing your job, things like that. There's also differences, when you look at the severity of the injury. So there's differences between the within province and out province, but the more severe the injury, the smaller the differences become. The smaller the differences if they're coming from neighboring provinces. In terms of when they're injured, these workers tend to have a longer disability duration, and the differences tend to be largest in these resource-related industries. So your construction, your mining, oil and gas. And then from the kind of qualitative work that's been done, leaving your province for treatment has been strongly related to the longer disability duration. There's also the importance of returning to your family after your injury and the financial difficulties that these workers can face. But that's kind of just thinking of one type of mobile worker in terms of out of province. Some of the research we've done has just been looking at disability and how it varies, even within provinces. And in some cases, you have as much variation within a province as you do between provinces. So we were kind of interested in trying to tease this apart and identify whether does inter-provincially mobile work matter as much as intra-provincially mobile work for your work disability? So that's our objective. That's what we're looking at in BC using workers' compensation claims data. So for this, we built off some of the previous work which relied more on just payments and benefits, but looking more at detailed return to work information. And we're like maybe the only study which has actually used both the employer and the residential location information that can be found in the claims. So from that, we were able to kind of separate out three groups in terms of what we call non-mobile, intra-provincially mobile, and inter-provincially mobile. And then we used lots of other claims information to statistically model differences between these types of workers at different types of claim duration, so kind of short, medium, and long-term claims. So just to kind of visualize what this looks like, how we created this. This is the map of BC. This is the Lower Mainland. Does the laser work? I don't think it does. Anyway, but these are economic regions. So this is what we use to define the intra-provincially mobile workers. And these economic regions are, as you can see here, groupings of census divisions, which could be legislated areas such as counties, districts, or equivalent. So basically, if your postal code of your your operating location and your residence is in the same economic region, you're considered non-mobile, which I can talk about the limitations of using that kind of term. But if you're traveling within them, within BC, you're intra-provincially mobile. And if you're traveling outside, so if your residence is in Alberta, for example, but you work in Northeast BC, you'd be considered inter-provincially mobile. And so mobile workers, regardless of their injury status, tend to be a select group. They have different demographic characteristics, different job characteristics. But this is just looking at the characteristics of those that have claims. We can see that they tend to be more likely to be male workers. They tend to be younger workers. They're more likely to be doing shift work as well. They do more manually intensive kind of occupations. And because of that, you also have different injury characteristics here. So it's maybe not so easy for you to tell from the slide here, but you can see things like fractures, more severe injuries tend to be more common, the more mobile, if you think of it in terms of inter-provincially mobile. And then here you can see you've also got your natural resources and mining, you've got your construction, you know, there's different industry differences in terms of the types of claims for these three groups. And also that feeds into differences in your work disability outcomes. So you can see here, the blue bar is the kind of more positive outcome, your return to work. But as you see, you know, further along you go, the lower likelihood of you actually having this return to work status after 2 years of follow-up in our data. You also see this really large orange bar here. This is your deemed return to work. So this is the compensation board essentially saying, we think you're fit enough to return to work, but they haven't actually returned to work. So it's important to do an actual, you know, robust analysis. We want to actually account for the selection differences in these groups. So in order to compare apples to apples, we do a matching, or you could almost imagine it like a twin study where you have, say, for example, a 41-year-old male construction worker with a fracture injury. One of them will be an inter-provincially mobile worker. We will match him with a non-mobile worker. And we did the same for both types of mobile workers. So we had 2 matched cohorts. And here are the results. This is after statistical modeling. This is essentially after accounting for age, sex, injury type, using the matched cohorts, looking at the difference in the disability days in a 2-year follow-up for these workers. I'd like you to start focusing on the right-hand side. Is if you think of the 75th percentile, these are your medium to long-term claims, comparing the inter-provincially mobile workers with the non-mobile workers. And you can see the bar is clearly much higher, right? Whereas if you think of the 50th percentile or the middle of the distribution, it's higher here as well. Even for the shorter duration claims of the 25th percentile, these are larger differences. And although it looks like there's almost no differences for the intra-provincially mobile workers, that's not true. These also have significant differences at all ends, all types of the distribution. So just to be more specific, so 75th percentile is 112 more disability days paid to an inter-provincially mobile worker, even after accounting for these characteristics. 23 more days, 5 more days. So yeah, I guess just based off this slide on its own, if you're thinking back to what our question was in the title, does inter-provincially mobile work matter more? You could say in terms of absolute and relative differences in days paid, it does, but it matters for both. Both types of mobile workers clearly have they have disadvantages and challenges in return to work. Thank you. I'll just very quickly go through the next 2 slides, but we did lots of different analysis of different subgroups to see whether the findings were consistent when you look at different industry sectors, different types of injuries. You might think, if we pick a fracture injury, for example, where you might expect more consistent recovery, regardless of where you live, it didn't really matter. We saw these really big differences across all different injury groups. But when we looked in sectors, we saw a little bit more interesting differences there. So in some cases, your natural resources and mining, the differences were actually decreased to almost being no difference in some cases. But then in other sectors, such as construction, it was actually worsened. So that's just if you visualize it there. So yeah, just to kind of wrap things up, this is one of only 2 studies that I know of that actually tries to use both the employer and the residential information, just to kind of dig a little bit deeper and trying, to our best ability, try and capture forms of mobile workers and not just out of province workers using workers' compensation data. We're also using this matching algorithm, which helps us to try and match the characteristics of these very different types of workers and their compensation claims. We're also using a more rich return to work calendar data, which is better than just relying on who's receiving benefits, for example. But I need to acknowledge the limitations. I'm sure you already have some which you're thinking of, but this non-mobile group isn't like, I say non-mobile because they could also be very mobile. Because if you think of an economic region like Greater Vancouver, even a census division within that, you could be traveling like many, many kilometers to and from work, and we're not capturing it with the information we have. We're also relying on the operating location, and we know that in certain sectors such as construction, the office location, which is affiliated with your WCB account, might be a head office in Vancouver, for example, and you might be doing operations in the north of the province. We're not going to be able to capture that. And it's similarly, we're relying on postal codes as well. Like, we only have 1 postal code per employer, per residence, so I can't track changes over time. For example, Desai showed survey results from maritime workers, and it was really interesting to see how many of the workers actually move after their injury in order to be able to access the correct healthcare. That's something that we can't actually look at with the data that we've had to date anyway. So yeah, just to wrap things up, to conclude, work disability duration is greatest for inter-provincially mobile workers, but intra-provincially mobile workers, there's more of them. I think of our claims, it was only about 1 to 2% were inter-provincially mobile, where it's more like 7 to 8%. So just because you're injured out of province, the Workers' Compensation Board shouldn't just kind of forget about you, and then they should be paying attention to this proportion of the workforce who are traveling within the province. And yeah, future research, especially qualitative research, is needed because there's only so much we can actually get at in terms of answers of the how or why we're seeing this. There's only so much I can answer. So I will. Again. Just want to acknowledge this was funded by the SHIRT Partnership Grant that was led by Catherine. And if you're interested, this work is actually published, and if you click on that code, you can download the paper yourself, and you can read more about it. So thank you very much.